Y'all still having a good time? Yes, sir. All right, so we're going to have Mikey from Tell Them come up and talk about his organization, and then we're going to get back into the entertainment, all right? Cool? All right.
Thanks. How is everybody today? Good. I am with Tell Them. I was hoping to have a projector today, but I went old school with some of these songs. Afterwards, we have our table over here. Everybody ready? What Tell Them is an advocacy group here in the state of South Carolina. We're kind of based in two parts. One part is down in Columbia, and we have a group of people down there who watch the legislators, and they watch to see when legislation comes up about things that are related to sexual health care. So anytime something comes up about teen pregnancy or HIV funding or STIs, the group down there tracks that, and then they alert the other people. And the other people are people like me, people like y'all, people around the state who are concerned about those sort of things. And then when we get these action alerts from our group down in Columbia, we're able to write to our senators and our representatives, we're able to send emails, and we're able to actually talk to them and tell them what we want them to do about that, whether we need more funding to help prevent these diseases or whatever we feel about that. Our group has put together a thing called a Bill of Rights. And these are some of the things that we believe. We believe that every young adult has the right to uncensored reproductive health education. We believe that everybody has the right to medically adequate instruction and counseling about your body. We believe that everybody has the right to practice their own religious traditions and beliefs about family planning. We believe that everyone has the right to be treated by physicians and nurses based on the latest research and the best medical practices. We believe that everybody has the right to decide whether and how and when they want to start a family. We believe that everybody has the right to make their own medical decisions about their health care. But sometimes that's not what happens. Last year there was a bill introduced called the Refusal of Care Bill. And what they wanted to do was to give doctors, nurses, physicians, pharmacists the right, if they had a moral or a religious objection to treating someone, to not treat someone. That meant if the pharmacist didn't like somebody because he thought having HIV meant you were homosexual or you were a drug user and he didn't agree with that, he could decide to not fulfill your prescription. If you were a young girl and you went into the emergency room because maybe you had been raped or something, the doctor, if he didn't think you deserved some treatments, he could just not tell you about it. Well, of course, we think that everybody deserves to have all the medical evidence and all the facts there so that you can make your own decision. So we went and we sent over 8,000 emails. We called the members of the Senate Medical Affairs. We had 15 people present testimonies in the legislature, and we had 30 one-on-one meetings with our legislators, the senators and the representatives. And because of that, that bill didn't even get out of the medical committee. Now this year, we're moving forward like groups like Catawba Care and some of the other groups in the state. We're going to start talking to our legislators about Medicaid expansion. That's part of the Affordable Health Care Act, things that we know of called Obamacare. And the Medicaid expansion will let people who are poor, like the working poor, people that earn 133% of federal poverty level, that's about $15,000 a year. So, those are the poor guys working at Walmart or a lot of fast food places who don't have health insurance. This would give them that health insurance. We'd like for our representatives to actually vote for this because we know that when people are treated by a doctor, it costs less. Because if you don't have a doctor, I'm sure some of us, I know I have, When you don't have a doctor, you end up in an emergency room. And some cheap thing that a doctor could take care of in his office is going to cost hundreds of dollars in an emergency room. And then when you don't have the money to pay, it means everybody else ends up paying. So if we can get everybody to have medical coverage, health insurance coverage, we know that we can have cheaper health care in our state. Also, when people have good health care and they stay healthy, they keep working, they keep paying taxes. So they actually end up keep paying for their own health care. Right now, Tell Them has just recently put out a report. We decided that we want to look and see what schools are teaching about sex ed here in South Carolina. Because I do a lot of work with several different groups, and it's nice to have the money to ask for money to help pay for people's medications and to make sure people get treatment. But you know, if we can put out some education so that people aren't infected in the first place, then we know that we save a lot of money, we save a lot of lives, and we save a lot of trouble. So Tell Them went and they did this study and they looked at the schools. First we looked at the law, and it was a law that was written in 1988, the Comprehensive Health Education Act. And actually it's a pretty good law because it discusses what kind of sex ed should be taught in high schools. And it teaches the right thing. It teaches a comprehensive kind of sex education. It talks about abstinence, it talks about contraceptions, it talks about STIs. The problem with the law, though, is there's not enough enforcement of it. So, for example, the law says that they were supposed to form a committee to watch over these schools to make sure that they were teaching the right thing. And we found that nearly most of the counties didn't have this board. Some of the problems that we looked at, too, when we found this, were some of the bad numbers in our state. Sadly, South Carolina has a lot of problems, and some of them are these healthcare problems. We found by this study that 1 in 5 middle school students reported that they had had sex. We looked more and we found that 60% of high school seniors reported having engaged in sexual intercourse. That's a pretty big number for a bunch of kids. Sadly, during this time, too, we found out another important number. We found that in the year 2005, 67% of students who said that were in high school that said that they were using condoms, there was 67%. And sadly, that number has gone down. And in 2011, it was reported that only 58%. So while more kids are ending up having sex, fewer kids are taking protection. And we know that people that don't take the protection end up putting themselves at a lot of risk for a lot of problems. For example, 3 out of 10 young women in South Carolina will become pregnant by the age of 20. That's 3 out of 10. We also found that the youth ages 15 to 24 accounted for nearly half of the STIs, those are the sexually transmitted infection. They accounted for nearly half of those cases that we have in our state. We found some other bad numbers too. South Carolina has the 3rd highest rate of gonorrhea and chlamydia. For teen pregnancies, that number makes our state number 12. For HIV, since that's one of the things that we're here talking about today, we found out that our state, several years ago, we had been the 10th highest, then we went to the 9th highest, and now sadly our state has the 8th highest rate of new HIV infections. So we're definitely going in the wrong direction for this. And if we don't do something more to prevent it, this rate will only continue to climb. So the solution solution then is going to be better education. Now, right now, the law says that students in high school are taught about reproductive health and pregnancy prevention. Students in middle school, that's 6th, 7th, and 8th grade, they're taught about reproductive health and sexually transmitted diseases. Supposedly, students are supposed to receive 750 minutes worth of reproductive health education in high school. What we found, though, was because the law didn't have any enforcement in it, many of the teachers weren't trained, so you ended up, some schools had health teachers, some schools had biology teachers. I heard from one that a history teacher was teaching sex education to the students. Many of these teachers then, of course, they're not trained properly, and so the teacher isn't trained, and they sure can't teach to our children. We also found, like I said, that those boards that were supposed to watch over this, most of the counties didn't have this. So what Telvin is doing now, we've gotten together with some of our legislators, and this year we're going to have them introduce a bill that helps put some accountability behind our sex education laws. That way, hopefully, our schools will actually start doing what they're supposed to do, because right now, it's a little hodgepodge throughout the whole state. After the meeting today, if you'd like to stop by our table, we've got a couple things that you might be interested in. One is a postcard. We have people fill out these with your name and your address, and we address it to your senator or your representative, and it really only asks that they do what's right and help make sure that the laws are passed so that our children have good sex health education. We also have the form that's got those Bill of Rights on it. And this is what we believe that everybody should have, good education so that you know the facts. Because in a state like ours where we have so many of these problems, I think that if we can get people better educated, we'll nip it in the bud and we won't have these kind of problems. All right, thank you. Don't forget to stop by our table.
Give Mr. Mikey one more round of applause for that. Very information. Very good information. Thank you very much for that. You guys ready?